You don't want to go from one session to the next and increase weight and reps and number of exercises and decrease your rest breaks and all that. Like, pick one factor, play with that one factor, then you're kind of mixing and matching and changing one factor at a time so that the body can be accustomed to all of these different changes over time.
Welcome to the Movement Driven Podcast with Dr. Greg Goldberger, where we help you bridge the gap between pain and performance. Each week, we'll share strategies, insights, and real-life applications to help you keep moving and stay driven. Now, let's get into this week's episode of the Movement Driven Podcast. Hello, everyone. Welcome back to the Movement Driven Podcast. I'm Dara here with Dr. Greg Goldberger. Greg, how you doing today?
I'm doing well. How are you?
Doing good. Are you enjoying your birthday month?
I am. Well, I'm another year older.
Well, whatever.
Well, what do you mean, whatever?
Age is a gift.
It's nothing but a number.
Yeah, it's a gift because there are people that didn't get to age past 15.
There you go.
Or didn't get
I'd
to
rather
age
be
0.
old than dead.
Yeah, exactly.
100%.
Exactly. So with that positive,
That's what we're all about. I should change the attitude.
with that positive,
I tell people all the time, "When you're 50, so what? We can get you feeling better." And like, I should listen to myself. All right.
yes, exactly.
Thank you, Dara, for the reminder.
With that positive note to kick off the episode, today we're going to talk a little bit about the spring sports surge. So this time of year, the weather's feeling good. The sun's coming out. It's, feeling better. Your body's not so stiff from the cold anymore. So injuries tend to kind of spike
They do.
during this
Yeah,
time of year.
especially, in Florida, we have it a little bit better, but especially for people that are in the colder weather states, it's something to really think about, that you can't just kind of go back to activity like you were in the fall, especially if you're an outdoorsy kind of sports person. So yeah, it's definitely something that we see kind of come to fruition,
Yeah.
unfortunately.
So why do injuries tend to spike when the weather warms up?
Yeah, I think it's kind of what I was alluding to there is, you're not going to do the same training sessions necessarily, especially if you're one that likes to work out outside, or if you're a CrossFitter. Like, there's no temperature control in most of these gyms, so it's actually colder inside the gym than outside a lot of the time. You can attest to that.
Yes.
So your body's going to move differently, or you just didn't move as much. So there's a deconditioning element, and if you come back to it and try to go at the same rate with the same pounds of force that you're trying to move, you're gonna lead to injury. You're deconditioned, so you have to kind of ramp it up slowly. You have to respect that, you don't want big increases in volume. That's what I see a lot of the time if we just talk about sports in general, like especially with my throwing athletes. The two times that baseball players get hurt are the beginning of the season and the end of the season. The beginning because they're not ready to ramp up volume, and in the end is just they didn't prepare themselves enough to have the endurance to last the whole season. Runners are the same way. When they get, tibial stress fractures or shin splints or kind of any injury, it usually has to do with a rapid increase in volume rather than some, one dumb thing that you did that caused an injury. It's over time. And so if you've changed the way that you've been operating through the winter months, and you want to just go hard in spring because you're craving it and you want to get outside and you want to move, be patient. Let's do it the right way so that you don't cause injury and then you're sidelined for even longer.
Yeah, for sure. So you're feeling better, so you do more,
Right?
But your tissues aren't ready.
They're not ready.
Yeah, exactly. So, okay, let's touch on that a little bit more. What actually happens inside the body when we suddenly increase load?
Well, I think like a lot of time the muscles the belly part of the muscle is ready to go, but the tendons take longer to adapt to high load. Like they're not ready. They're made up of collagen. They're not ready to just explode. The way that we train tendons is we want to really work on the negative part of an exercise, or eccentrics, so that we're elongating them under tension, and then kind of build that back to the concentric portion of the power movement and the push or the pull movement. So just because your muscles feel good and you feel good doesn't mean that your tendons are actually ready to go. And tendons are attaching directly close to those joint surfaces. So if we're not pulling on certain structures the right way, now the joints are getting forces that are asymmetric, and that's how we kind of create injury, so to speak. So it's just a matter of conditioning the right way, taking your time, and not doing too much too soon.
Yeah. And also, we've talked about this before, but the difference between soreness and overload, and really paying attention to how does that feel and what does that look like for you?
Right. And I think we talked about too, like even like the plateauing of certain if you're trying to increase your one rep maxes, or you're just trying to get stronger in the gym and you've hit a plateau, that might be the first sign that you're overtraining or need more rest, or you've gone up too quickly in volume. So it doesn't always have to be pain or soreness. It can just be like, I'm not as strong today. And there might be a reason for that other than, I mean, it could be sleep or diet or something, obviously, but it might be that you're training too much too quickly.
Yeah. So you mentioned how feeling good is not the same thing as being prepared,
Right.
and volume and things like that. So how do you recommend we go about that?
Well, I think, like we've talked about in previous episodes, I think we talked about in the last episode, we have to do things in the right order. So if we're trying to get back to power and speed, which most sports do require some element of power and speed, we have to make sure that we've done the strength training, we've done the endurance training, we've done the mobility training first. So if you haven't even been doing that over the winter months, then we have to start there, and we have to build up over time just from the type of exercise you're doing. It's not just about ramping up load or reps or things like that. But when we do start to talk about that in terms of, like, for a runner, for instance, when they're going on their training program and they're trying to train for a marathon, they're not just running 18 miles like they're running 2 miles and then 4 miles, and then then they might stay at 4 miles for a little bit and play with their speed with it and try to get the time of 4 miles up. And then we can add mileage. So it's kind of what I always recommend to patients is we're just changing one factor at a time. You don't want to go from one session to the next and increase weight and reps and number of exercises and decrease your rest breaks and all that. Like, pick one factor, play with that one factor, then you're kind of mixing and matching and changing one factor at a time so that the body can be accustomed to all of these different changes over time. So I think, honestly, it's just, there's some common sense that needs to be had there, where you just don't do too much too soon. Even though you feel, like you said, you feel good, it doesn't mean you're ready. And so that's where, I've said this too before, having us as a a good physical therapist in your camp, on your team, to just do a once over checkup every 6 months or 12 months. If you're an active individual, like, that should be a standard practice, in my opinion. I might be a little biased, but I think having another set of eyes on you to give you an exam, see what's going on, see, hey, this was moving much better than 6 months ago. Let's add these 2 or 3 things in to try to get more mobility here. Or, hey, you're not recruiting that muscle the way that we talked about before. Let's review how to do those exercises again. I don't think that can be overstated or is a bad idea at all. So get somebody in your camp that's watching you. Don't think you know it all, because you don't. Sorry.
Yeah, exactly. And I think a good mindset to think about for some of our listeners here is, when you're increasing activity this month, it's great that you have motivation. You should have the motivation.
For sure.
At least
That's gotta be there. Yeah.
Yeah,
That's gotta be first.
but you do have to have a plan. Like, your body
Yeah.
needs a plan so that when you are going and going and going, you don't just hit a wall, get injured, and then it crushes your motivation.
Yeah.
So if you have a plan, then it can stay structured so you can keep growing and improving and not just like have to sideline yourself.
Well, and and we've talked about, and once you are sidelined, especially with an injury, forget the winter months of just being a little more inactive. It's hard to get over that first hump. Like, I talk to people all the time, they have a knee injury and they haven't been running for a while. That first phase of just getting back into it is the hardest. So, like you're saying, having a plan, doing it systematically, understanding that your body is responding, even if you're not seeing the results, as long as you're increasing slowly over time in terms of, mileage or whatever it is that you're trying to do, you're going to get to that goal, and just kind of be patient. You'll get there.
Yeah, absolutely. Is there anything else that you want to add to talk about this topic before we move on?
Yeah, so I would say we did a couple episodes. We talked about PAP, which is post-activation potentiation. So I would say, if you're listening to this podcast and you haven't listened to that one, go give that one a listen, because that's going to be a real good way of learning, like, how to prime the nervous system, how to warm up correctly. We've talked about in previous episodes. So I think all those things are super important to have that increased warm up, that increased neural activity priming effect, so that your body is more ready than you even think it is when you're getting back into training.
Yeah, absolutely. All right. Well, thanks so much, Dr. Greg. This was a great episode, and we'll catch you on the next one.
Alrighty, guys. See ya.
Thanks for tuning in to the Movement Driven Podcast with Dr. Greg Goldberger. Want to see how we're helping people in Jacksonville bridge the gap between pain and performance? Head on over to movementdriven.com. Until next time, keep moving, stay driven.